When's the last time you woke up with a firm morning erection? Not last week, not last month. And if you're honest with yourself, you're not entirely sure. When it stopped, because somewhere along the way, you stopped expecting it. I'm Dr. Neraya Wolfe, urologist and pelvic surgeon. And what I need you to know, before we go any further, that absence is not a verdict. It has a real biological explanation. And that explanation points directly to a solution. One that takes 3 specific minutes, done before bed, to put into practice. Here's the most important thing I need you to hear first. This isn't aging, it's depletion. And depletion can be fixed. The explanation most men receive, when they're willing to bring this up at all, is simply, it's part of getting older. It's normal. It's expected. And I understand why that answer gets given. Time is short, the appointment ends, you walk out with no real path forward. But that answer is incomplete, and for a significant number of men, it is simply wrong. What I'm going to give you today is the real biological picture, and a specific, evidence-backed practice you can begin tonight. Let me start with something that genuinely surprises most of the men I see in my practice. Morning erections. The medical term is nocturnal penile tumescence, though I'll spare you the Latin from here, are not primarily a sexual event. They are a biological maintenance event. A health check your body runs on itself, every single night, whether you're aware of it or not. During the deepest stages of sleep, your body enters REM sleep, rapid eye movement sleep. And during each REM cycle, which happens 3 to 5 times a night, your nervous system sends a signal to the erectile tissue of the penis that causes it to fill with blood. This isn't about desire, it isn't about dreams, it is your body ensuring that the tissue stays well oxygenated, elastic, and healthy. Think of it like a hydraulic pump running a test cycle. Your body has engineered a nightly system to push blood through that tissue, flex it, oxygenate it, and keep it supple. The same way you'd periodically run a piece of equipment to prevent the seals from drying out. When you wake during or just after one of these cycles, you notice it. That's a morning erection. Now here's the part that changes the conversation entirely. The presence of reliable morning erections tells you something important about your body. It tells you your blood vessels are functioning well, that your nervous system is doing its job, that your testosterone levels are supporting the process the way they should, that your sleep is reaching the depth it needs to. Morning erections, in other words, are one of the most honest health reports your body produces, and they do it every single night for free. So when they start to fade, when the man who once barely noticed them begins to realize they haven't been there in weeks or months, that absence is worth paying attention to. Not with alarm, with curiosity, because that change is almost always telling you something specific. By the time a man reaches his 50s, a number of things have been quietly shifting inside his body for years. Let me walk you through the 4 layers, because they all connect. First, testosterone. The gradual decline that began in a man's 30s has now accumulated a decade or more of slow fade. By 50, many men have testosterone levels meaningfully lower than they were in their prime, low enough to affect not just desire, but the entire hormonal environment that drives nocturnal erections, sleep quality, and energy. The signal your body uses to trigger those nightly maintenance cycles becomes quieter, and quiet signals produce quieter results. Second, cardiovascular health. The blood vessels supplying the erectile tissue are among the smallest in the body. They're like the narrowest pipes in your home's plumbing, the first to show the effects of pressure, buildup, and years of wear. When those vessels lose elasticity and efficiency, the quality of blood flow during those nightly maintenance cycles is the very first thing to change. Before the heart shows any sign of strain, before any other system raises a flag, the penis shows it first. Third, sleep architecture. After 50, deep restorative sleep becomes shorter and harder to reach, and since those deep sleep stages are precisely when nocturnal erections occur and when testosterone is most actively produced, disrupted sleep creates a compounding effect that touches multiple systems simultaneously. Worse sleep means fewer maintenance cycles. Fewer maintenance cycles means less tissue conditioning. Less conditioning means morning erections that are weaker or absent. Fourth, and this is the one almost nobody mentions, the pelvic floor. Most men have never been told they have one. We discuss it constantly in women's health. In men's health, it remains largely invisible until something goes wrong. The pelvic floor is a group of muscles sitting at the base of the pelvis, forming a kind of hammock that supports the bladder, the bowel, and critically, the base of the penis. These muscles play a direct, measurable role in erection quality, not just in achieving an erection, but in sustaining one. After 50, without deliberate exercise, they weaken. Quietly, gradually, without announcement. Here's where most men are genuinely surprised. Even when blood flow is adequate, even when testosterone is reasonable, if the pelvic floor muscles responsible for keeping blood inside the erectile tissue are weak, the erection won't be as firm or as lasting as it should be. Think of a dam with hairline cracks. The reservoir fills, but the water seeps away faster than it should. The structure looks intact. The problem is in the seal. This is why so many men are confused. Their labs look acceptable. Their doctor tells them nothing is catastrophically wrong. But something has changed, and nobody has pointed to the muscles. Let me introduce you to two muscles that have probably never come up in any conversation about your health, and yet have been quietly influencing your sexual function your entire adult life. The first is the ischiocavernosus muscle. This muscle wraps around the root and base of the penis. Its primary job during an erection is to compress the erectile tissue, to maintain internal pressure so that the erection stays firm. When this muscle is strong and responsive, the quality of an erection is noticeably better. When it weakens, even a normal erection can feel softer, less reliable, harder to sustain. The second is the bulbospongiosus muscle. This one wraps around the base of the penis and plays a particularly important role in something men notice but rarely understand: the fading erection. The bulbospongiosus compresses the deep penile veins, the veins that, if left uncompressed, allow blood to drain back out of the erectile tissue before an erection is fully established or while it's still needed. A well-trained bulbospongiosus holds that blood in place. A weak one lets it leave too soon. Together, these two muscles function like a two-part valve system. One builds pressure, one seals it in, and like every other muscle in the body, they respond to training, and they deteriorate when they're neglected. Now, what makes the evening uniquely suited to this practice? When you exercise these muscles in the hours before sleep, you're priming the pelvic floor at precisely the time when the body is preparing to enter its overnight repair cycle. The muscles you activate through this exercise are the same muscles that will be called upon during those nocturnal maintenance cycles just hours later. Training them immediately before that window is the equivalent of warming up before the most important workout of the day, except in this case, your body runs that workout automatically while you sleep. There's also a neurological dimension to this timing. The nervous system pathways that govern erection function, specifically the parasympathetic pathways, are most accessible when the body is calm, relaxed, and preparing for rest. Performing pelvic floor exercises in that pre-sleep state reinforces those parasympathetic connections in a way that midday practice simply cannot replicate as effectively. Now, before you say, "I've heard about pelvic floor exercises before, and I'm not sure I believe they make a real difference," let me stop you right there. Because this is exactly the moment where most men close a door that deserves to stay open. The research on pelvic floor training for erectile function is not ambiguous, and it is not new. A landmark study published in the British Journal of General Practice followed men with erectile dysfunction through a structured pelvic floor exercise program. The results were striking. 40% regained completely normal erectile function. A significant additional portion experienced meaningful improvement, and a follow-up study in BJU International confirmed those gains were sustained long after the supervised program ended, which means this is not a temporary fix. It's a genuine, lasting biological adaptation. What I find equally significant is the profile of the men who benefited most. They weren't men with severe vascular disease or profoundly low testosterone. They were men whose erections had gradually declined, men who might have been told by their doctors that everything looked fine. On paper. Men, in other words, very much like the men watching this video right now. The mechanism is straightforward. When you consistently train the ischiocavernosus and bulbospongiosus, those muscles become stronger and more responsive. They perform their role more effectively during erections, both the ones that happen while you're awake and the ones that happen while you sleep. Over time, that improved nightly maintenance translates directly into better morning erection quality and more reliable function during intimacy. 3 minutes a day. Consistent practice over 6 to 12 weeks. Real measurable change. I've watched it happen for thousands of men, and I believe you will see it happen too. Before I walk you through the exact practice, if the kind of honest, evidence-based education you've been getting in this video is what you've been looking for, I'd ask you to subscribe to this channel. Every week, we cover the topics most men never get real answers to in a clinical appointment. That's exactly what we're here for. Now, let's give you the 3-minute practice. Step 1. Find the right muscles. This is the step that determines whether everything else works, and it's where most men who've tried this before went wrong. Here is the most reliable method to locate your pelvic floor. Imagine you are in the middle of urinating and you want to stop the flow midstream. The muscles you would engage to do that, without squeezing your glutes, without tightening your legs, without holding your breath, those are your pelvic floor muscles. Another reliable reference. Imagine you're in a quiet, crowded room and you need to prevent passing gas. Same group, same sensation. You should feel a subtle internal lift, an upward and inward draw at the base of your pelvis, not a dramatic clench, not a full body contraction, a quiet, deliberate, isolated movement. Take a moment now, if you'd like, to try that. Find the sensation, get comfortable with it before we move into the practice itself. Think of it like trying to move just your ring finger without moving the others. The first time, everything moves together. With practice, the isolation becomes precise. This is exactly the same learning process. Step 2, the contraction hold release sequence. Lie on your back, knees bent, feet flat and hip width apart. Let your arms rest at your sides. Take 2 or 3 slow, natural breaths. Let your abdomen relax completely. Let your jaw soften. Let your shoulders drop. You want your whole body as calm as possible before you begin. As you exhale, slowly, gently engage your pelvic floor, that upward, inward lift. Keep your breath moving, keep your glutes soft, keep your thighs relaxed, just the pelvic floor. Hold that contraction for a slow count of 5, then release. Slowly, fully, deliberately, for a count of 5. That full release matters as much as the contraction. You are teaching these muscles both how to engage and how to completely let go. Both capabilities are essential for healthy erection function. A muscle that can only tighten and never fully relax becomes a problem of its own kind. That is 1 repetition. Rest for 5 seconds. Then repeat. 10 repetitions is 1 set. 2 to 3 sets. Each evening is your target. At a relaxed, unhurried pace, full holds, full releases, this takes approximately 3 minutes. Step 3. Common mistakes to avoid. 3 things I see consistently in men who try this and don't get results. Holding the breath, the most common error. When you hold your breath, you increase intra-abdominal pressure that works directly against the pelvic floor engagement. Let the breath flow naturally throughout every repetition. Rushing the release. Men contract with focus and then release carelessly in half a second. Slow that release down. Count it out. The coordination benefit lives there. Squeezing the glutes. If your buttocks are contracting, you've lost the isolation. Consciously soften them before every single repetition. Quality of engagement matters far more than quantity. 10 well-executed repetitions are worth more than 50 careless ones. I want to give you an honest biological timeline, because understanding it will help you stay consistent when the early weeks feel quiet. Weeks 1 through 4. You are building the neurological connection. Your brain is learning to communicate clearly with muscles it has largely ignored for years. You may not feel dramatic change yet. That is completely normal. The adaptation is happening below the surface. Weeks 4 through 6. Genuine strength begins to develop. The engagement becomes easier. The isolation becomes more natural and more reliable. Weeks 6 through 12. This is when most men in my practice begin to notice something shifting. Morning erections that had been absent or inconsistent begin to return. Erections during intimacy feel firmer. There's a sense of more control, more presence, more reliability. After 12 weeks, you can progress. Extend the hold to 8 seconds, then 10. Begin practicing in other positions, seated at a desk, standing while you brush your teeth. The goal over time is for these muscles to respond reflexively, the way a trained reflex operates rather than a conscious effort. The men who commit to this consistently, not perfectly, but consistently, come back and tell me it was the simplest and most impactful thing they had ever done for their sexual health. I've had men in their 60s say, quietly, that they wished someone had explained this to them 20 years earlier. If you experience any discomfort or pain during this practice, please stop and speak with a urologist or pelvic floor physical therapist before continuing. For the vast majority of men, this exercise is entirely appropriate, but individual assessment is always valuable, particularly if you have a history of pelvic surgery or chronic pelvic pain. The 3-minute practice is powerful, but it works best within a broader foundation. And I'd be doing you a disservice if I didn't widen the picture. Sleep quality. The health of your nocturnal erections is inseparable from the quality of your sleep. Deep sleep is where these maintenance cycles happen. If your sleep is fragmented, whether from stress, from alcohol, from screens that keep your nervous system aroused at midnight, or from an undiagnosed condition like sleep apnea, the nightly maintenance cycle is being cut short. Sleep apnea in particular is one of the most common and most underdiagnosed contributors to both erectile dysfunction and low testosterone in men over 50. If you snore loudly, if you wake feeling unrefreshed regardless of hours slept, or if a partner has ever told you that you stop breathing during the night, please get evaluated. Treatment for sleep apnea frequently produces dramatic improvements in erection quality and morning function because it restores the deep sleep stages where so much of the body's hormonal and vascular maintenance actually occurs. Testosterone and hormonal health. Testosterone and hormonal health. Testosterone is the hormonal engine that drives the nocturnal erection cycle. When levels fall significantly, the signal that triggers those nightly maintenance events becomes weaker. If you're over 50 and experiencing changes in morning erections alongside fatigue, reduced drive, changes in mood or body composition, please have your hormone levels checked. A simple blood test measuring total and free testosterone, done in the morning when levels are naturally at their peak, gives your doctor a genuine picture of where you stand. And if levels are low, there are real options, from lifestyle changes that can shift testosterone meaningfully to properly supervised hormone therapy for men where lifestyle alone isn't sufficient. Don't rule anything out before having an informed conversation with a urologist who knows your complete picture. Cardiovascular health and blood flow. Let me say something plainly, because it deserves to be said plainly. The arteries supplying the erectile tissue are among the smallest arteries in the body. Think of your circulatory system as a network of pipes. The arteries feeding your heart and kidneys are the main lines, wide and resilient. The arteries feeding the penis are the narrowest branches in the entire network. They show the effects of cardiovascular damage earlier and more visibly than any larger vessel, which means that changes in your erection quality, including the quality of morning erections, can be an early warning signal of vascular changes that haven't yet reached the heart. Regular aerobic exercise, even 30 minutes of brisk walking most days, improves endothelial function, the health and responsiveness of the inner lining of your blood vessels. It speaks directly to the foundation that erection quality depends on. For many men, this single change produces improvements that rival any medical intervention. Stress and the nervous system. An erection requires the parasympathetic nervous system to be dominant, the rest and connect state. Chronic stress keeps the sympathetic nervous system in charge, the fight or flight state. These two systems cannot operate at full power simultaneously. Stress and erections are physiologically in direct competition. This is why the pre-sleep timing of the pelvic floor practice matters as much as the practice itself. You are engaging these muscles in the one window of the day when the parasympathetic state is most naturally accessible. Managing chronic stress is not a soft recommendation, it is a clinical one. I want to speak to this directly, because I think the threshold for seeking care often feels much higher than it needs to be. If you've noticed a meaningful change in your morning erections, not just occasional absence, but a consistent pattern of decline, that is worth a conversation with a urologist. Not because something is necessarily frightening, but because your body is sending you a signal, and you deserve to understand what it's saying. The men who do best are not the ones who wait until something feels like a crisis. They are the ones who come in with curiosity rather than alarm, who say, quietly but honestly, "I've noticed a change, and I'd like to understand it." A proper evaluation is not intimidating. It's a conversation, some blood work, an examination, targeted questions about your sleep, your stress, your lifestyle, your medications. From all of that, a clear picture emerges, and with that picture comes a path forward grounded in your actual biology, not in guesswork or general reassurance. Please don't let embarrassment be the reason you delay. I promise you, I have had this conversation with thousands of men. You are not unusual, you are not alone, and there is nothing here that your urologist hasn't heard and addressed with care and genuine respect. Before you close this video, I want to ask you something. What have you lost? Not to shame you, but honestly, what has this cost you? In intimacy, in the quiet confidence of feeling fully present in your own body, in how connected you've been able to be with the people who matter most to you? Because here is what I know from treating thousands of men who have carried exactly this question quietly, the ones who recover and most do, are the ones who stopped explaining it away, who chose to listen to what their body was telling them and decided it was worth 3 minutes before bed to begin answering it. The body is not your adversary, even when it feels like it is. Even when the changes are confusing or frustrating or quietly frightening, it is doing what it was designed to do, communicating with you. Morning erections are one of the clearest messages your body sends, and their return, after months or years of absence, is something I have watched happen again and again in my practice, not through dramatic interventions, but through consistency, through showing up for a few quiet minutes before sleep and letting the body do what it was built to do next. I've watched it happen for thousands of men in their 50s and 60s who came in convinced something was permanently gone, and who came back changed, not through dramatic interventions, through consistency, through getting this right and committing to it. Tonight, before you sleep, try it. Lie down, breathe, find those muscles, 10 contractions, slow and deliberate, full release each time, 2 to 3 sets, then let your body do the rest. You don't need to be perfect, you just need to begin. If today gave you something real, something you can actually use, please subscribe to this channel. Every week, we cover the topics most men never receive honest answers to. I've also linked a video above that picks up directly from where we left off today, going deeper on the hormonal and vascular side of this picture. Take care of yourself, because you are absolutely worth it.